Oral cancer is far more common than you might think. In fact, according to the American Cancer Society, unlike the levels of other types of cancer that have decreased over the past 40 years, the incidence of oral cancer has actually increased by almost 6%. Oral cancer is a deadly disease. Every hour of every day, one American dies of oral cancer. As is the case in most types of cancer, these fatalities occur because the oral cancer is found much too late. But thanks to a remarkable new dental screening procedure called the Visilite, it doesn't have to be that way. Much like mammography has done to significantly reduce the death rates for breast cancer, the Visilite test can do the same for oral cancer. Oral cancer is actually one of the most treatable forms of cancer when it is detected early. That is what makes Visilite screening so critical to those at risk. Age is one of the greatest risk factors involved in the development of oral cancer, with more than 90% of victims over the age of 40. Tobacco use, of course, can increase your risk of acquiring oral cancer, and gender seems to play a role as well. Studies indicate that more men than women develop oral cancer. As with any cancer, you are at greater risk if you have a family history of the disease. Visilite uses a light technology that has proven to be effective in detecting tumors and soft tissue abnormalities in other areas of the body. During the Visilite screening, the dentist will have you rinse with a special cleansing solution. Then the overhead lights will be turned down. Next, your dental professional will examine your mouth using the Visilite. As the Visilite passes over your mouth and gums, this special solution makes healthy tissue appear dark, while abnormal tissue lights up and appears white. The Visilite allows your dental professional to identify tissue changes at their earliest stages. If abnormalities are detected, your dentist will determine what the appropriate next steps will be. It is important to keep in mind that a positive result on a Visilite exam does not necessarily mean you have oral cancer. The light also reveals benign abnormalities caused by injury or other trauma. But if it is cancer, when oral cancer is found at its earliest stages, treatment is more than 90% successful. With early detection using the Visilite, treatment is quicker, simpler, far less involved, and it has a much greater survival rate. Nobody wants to think about cancer, but if you are over 40 or have any of the other risk factors, you should think about adding oral cancer screening to your next regular dental checkup. Please contact your dental professional today to see if Visilite is right for you.